Welcome to Wellness Warrior Radio, where we learn and practice reclaiming wellness as our birthright. No matter who you are or where your people are from, someone fought and survived tumultuous conditions for you to be here today. I am your host, Linda Wells, also known as Linda Wellness Warrior. I am a clinician in training and a doctoral student. And in this podcast, I'm sharing my reflections and lessons as a student and a clinician in training. I'm currently working in a child CBT program that provides gender-affirming care to youth, adolescents, and young adults. In today's episode of Wellness Warrior Radio, we're talking about transgender youth and mental health. Let's start here. Gender identity is not a disorder, but the world's misunderstanding of it, and it can cause real harm. The DSM-5 recognizes gender dysphoria, the distress that can arise when identity and assigned sex don't align. But identity itself is not pathological. In our first segment, we're going to talk about myths versus facts. So let's do some myth busting. Myth number 1, being transgender is a mental illness. Fact, it is not. The DSM-5 recognizes gender dysphoria, the distress that can arise when identity and assigned sex don't align. But identity itself is not pathological. Myth number 2, trans youth are confused. Many trans children express a consistent, insistent, and persistent sense of identity. This isn't confusion, it's clarity. Myth number 3, affirming gender identity makes things worse. Fact, affirmation is protective. It reduces depression, anxiety, and suicide. Now let's talk about the numbers. According to the Trevor Project's 2025 longitudinal study, 40% of LGBTQIA+ youth seriously considered suicide in the past year, with transgender and non-binary youth at the highest risk. 68% reported symptoms of anxiety. 54% reported symptoms of depression. But there's hope. Having just one affirming adult reduces suicide risk by 40%, according to the Trevor Project, 2025. Schools with inclusive policies see fewer suicide attempts and lower bullying rates, according to Gleason, 2024. These numbers don't reflect identity as a disorder. They reflect the impact of rejection and the impact on daily life. When trans youth are supported, they thrive. But when they're rejected, the impact is profound. At home, rejection can lead to isolation, anxiety, even leaving the home, and youth dealing with homelessness. At school, misgendering, bullying, and exclusion increase distress. With peers, affirmation fosters resilience, while exclusion deepens pain. In this next segment, we're going to talk about the risks that come from stigma, not identity. Let's be clear, the mental health risks that trans youth face are not because they're transgender. They come from stigma, rejection, and lack of support. When a child's identity is met with misunderstanding or hostility at home, in school, or in their community, it sends a message that they are unsafe, unwelcome, or unworthy. That message can take root in the body, mind, and the spirit. Here are some signs to watch out for: withdrawal, hopelessness, or self-harm. A trans child who once laughed freely may begin to isolate, avoid eye contact, or express feelings of worthlessness. Some may engage in self-harming behaviors, not because they want attention, but because they're trying to cope with overwhelming pain. They may have some somatic complaints, physical complaints, like headaches or stomach aches that are unexplained. These aren't just physical symptoms. They're the body's way of saying, I'm not okay. Chronic stress, from being misgendered, bullied, marginalized, or excluded can show up as tension, nausea, or fatigue. School refusal or sudden changes in mood. If a child starts dreading school, it may not be about the academics. It could be about the bathrooms, the pronouns, or being called the wrong name. Mood swings, irritability, or emotional shutdowns may reflect a deeper struggle with identity and validation. These signs are not proof of a disorder, they're signals of distress in a world that hasn't yet made room for their truth. They're signals of a distress in a world that hasn't yet made room for their truth. As clinicians, caregivers, and community members, our role is not to fix the child, it's to fix the conditions that make them feel broken. If you notice these, reach out. Support saves lives. Who to contact when assessing what may be going on with your loved one? Start with your child's pediatrician, a school counselor, or a mental health professional trained in gender affirming care. An assessment isn't about diagnosing identity. It's about understanding your child's experience and building a plan for support. Some interventions and resources. So let's talk about what helps. Because while the risks are real, so is the power of support. Evidence-based interventions can make a profound difference in the lives of trans youth. And they're not just clinical tools, they're acts of care, like gender affirming therapy. This isn't about changing who a child is, it's about helping them feel safe, seen, and supported. In gender affirming therapy, clinicians validate a child's identity, explore their experiences, and help them build coping skills for navigating a world that may not always understand them. It's a space where pronouns are respected, names are honored, and the child's truth is central. Research shows that gender affirming care reduces depression and suicidal ideation. Family therapy also strengthens acceptance. Families are powerful when caregivers and parents are supported and understanding and affirming their child's identity. The entire household becomes a source of resilience. Family therapy helps unpack fears, clarify misconceptions, and build communication rooted in love and respect. It's not about perfection, it's about presence. Even one affirming adult can reduce a child's risk by 40%, according to the Trevor Project. School advocacy for safe, inclusive environments, meaning schools can be either a sanctuary or a source of stress. Advocacy means ensuring that trans youth have access to gender neutral bathrooms, are called by their chosen names, and are protected from bullying. Inclusive policies like anti discrimination guidelines and staff training don't just benefit trans students, they create a culture of belonging for everyone. And studies show that schools with LGBTQ inclusive policies report lower rates of bullying and suicide attempts. These interventions aren't just clinical, they're relational, cultural, and spiritual. They say to a child, you matter, you belong, you are not alone. And that message is medicine. Some of the national resources available are the Trevor Project, which you can find a link below, Gleason, PFLAG, Human Rights Campaign, Child Mind Institute. And as we talk about evidence-based care, I also want to name something deeper because healing just isn't about protocols. It's about presence. And as a BodyTrust provider, I believe in honoring the wisdom of the body and the sacredness of identity. So before we close, I want to offer a reflection, not just as a clinician in training, but as someone who sees healing as a spiritual practice. Body trust emphasizes trusting and honoring our bodies. especially for trans and gender nonconforming folks. Supporting trans and gender nonconforming people means creating spaces where their embodied experiences are respected and valued. It's about listening without judgment, affirming their identities, and recognizing the resilience it takes to live authentically. Body Trust reminds us that healing involves reconnecting with our bodies in ways that feel safe and empowering, especially when society often invalidates these experiences. For parents and caregivers, this means fostering environments where children feel seen, heard, and supported in their gender journey. Closing segment. So here's the truth. Gender identity is not a disorder. What puts trans youth at risk is rejection. What protects them is affirmation, inclusion, and care. If your child's worries feel bigger than their childhood, help is available. And if your child is trans, know this: their identity is valid and your support can be life saving. Honor the wisdom of the body, the dignity of lived experience, and the right of every child to feel safe in their skin. Healing isn't just clinical, it's relational, cultural, and spiritual. When we affirm a child's identity, we honor their soul's truth. When we listen deeply, we become vessels of grace. When we create safe spaces, we invite wholeness. Supporting trans youth isn't just a mental health intervention, it's a spiritual practice of love, justice, and belonging. This is Linda Wellness Warrior, your clinician in training, signing off, thanking you for listening, and may we all become stewards of healing.